Good evening. I'm Keith Nagy. I'm the CEO of Teton Valley Health. With me is Dr. Nathan Levanger, the CMO, Chief Medical Officer, and our infection preventionist, Nikki Ripplinger. We're here tonight to answer any questions that you might have about the vaccines, testing, COVID in general, and try and resolve some issues that are out there in terms of what to expect with vaccines, what type of testing we're doing, and anything else you can come up with. So we have some questions that we've already gotten. We'll be watching online to see if you want to post any more. We are at the old high school auditorium, if anybody would like to come see us in person. And we will be here until we're done answering the questions. So with that, I'm going to start with the first question that we received already, and that is, the question was, can we address the current percentages of vaccinated persons in Teton County? Could you also talk about the degree to which you are seeing vaccine hesitancy and what its impact is on our ability to achieve herd immunity? So today's statistics that are published by the state shows that 43% of adults 16 and above that are residents of Teton County have received one or more doses of a vaccine. Of that 43%, 28% are fully vaccinated, meaning either they've received both doses of the Pfizer or the Moderna vaccine, or a single dose of the Janssen or Johnson & Johnson vaccine. And 15% have only received one dose of either Moderna or of the Pfizer vaccine. So 4,104 people have received one or more doses. The population that the state ascribes to us is 9,552. So we have 43% currently, and we assume the 15% that are halfway there will get there in the next several weeks. So Nathan or Nikki, I'm going to turn over to you in terms of what you've been seeing in terms of hesitancy, people not getting the vaccine and any particular reasons for that.
Go ahead.
Well, I was just going to mention that so far at our own hospital, within our healthcare system, and then also opening up to the community, mostly we have seen people sign up that want the vaccine. The people maybe that are against it or have worries about it, they haven't called in or requested to have a vaccine. So I think so far we've mostly just addressed our community members who definitely wanted the vaccine.
Yeah, and I think I've seen in the clinic, I've talked to a few people who have had some questions about the vaccine, but I haven't addressed or talked to anyone who's specifically against the vaccine or had really strong feelings that they weren't going to get the vaccine, as I've discussed in there.
So when we first got the vaccine and opened it to the public, we got 60,000 plus phone calls on the first day we were open. And that's not 60,000 people. Many people made multiple calls, and I do apologize. I know that was a rough day for people who really wanted it. 3 weeks ago, as we went through a vaccine waiting list that the state had, we got 60% of the people off that list who still wanted a vaccine. 1 week ago, as we went through a list that the same list that the state had, we got less than 10% of the people on that list who still wanted a vaccine. So to Nikki's point and to Dr. Levanger's point, I think we're seeing most of the people that really want the vaccine and are willing to do things to get it have already gotten it here or elsewhere. We are open again this Thursday. We're running a vaccine clinic. We are not full. Rulan's is doing vaccines as well as Corner Drug. So we have capacity right now for vaccines in the Valley. And we encourage you, if you've been hesitating because you think there's too much of a line or you can't get to the right site at the right time, please call in, please try and figure out how to get the vaccine. We're trying to make this easier. So we've started a process of outreach to major employers to see if there are things we can do to make it easier to get a vaccine. We've talked to some of those employers, we visited some of those employers as well, where they have enough people to make it worthwhile to go out and do that site visit. And where that makes it easier on the employees, because in many cases, we're ensuring that the employees have the ability to get the vaccine. Corner Drug has done weekend and Saturday vaccination clinics. We anticipate those continuing. We'll look to do that as well if there is sufficient need. So we think that we still have a large body of individuals that can be vaccinated in the Valley, and we look forward to making it as easy as possible to get to those folks. The second part was herd immunity. So I'll take the first cut at this, and then Dr. Levanger, if you'll correct me after this. Herd immunity is the concept that enough individuals have, through either having gotten COVID and or gotten the vaccine, protection against COVID. And then if enough get that, the ability of the COVID virus to replicate and to go through the population is significantly diminished. It does not mean there'll be no more COVID. COVID, like the flu, like colds, will continue to run its course, but it means that the amount of COVID we will see will be significantly reduced. And I think what everybody wants to hear is it going to be reduced to the point that we don't wear these masks, that we don't do all the things we're doing at this point? And the answer is, we don't know an exact percentage. I can give you different quotes. I'm sure Dr. Levanger and Nikki can add to the quotes. We're trying to figure out what that is. We're learning about the virus. It's certainly not 43%. It has to be a large majority of those individuals that have the ability to fight the COVID virus through the vaccine or having had it. As we get to that point, we're going to be following CDC guidance as well as guidance from the state in terms of what that means and how to relax the restrictions and get back to, I'm not going to call it normal, but the new normal. Dr. Levanger, you want to add to that?
Sure. So I can throw out a number that, the numbers that I've heard to get vaccinated to be able to reach that point of herd immunity is somewhere between 70 and 80%. And the thought being, I guess it's hard to decide exactly where you're at, because we've got numbers, because we know how many people we've given the immunization to. We don't have the exact numbers of how many people actually had the virus. And so I think to be safe, we look at the numbers that we know of who's actually had the vaccine and use that as our guiding point to say, here's what we're shooting for to get to that herd immunity point.
Nikki, do you have any thoughts on that as well?
I don't. I agree with both of you.
Okay. The next question deals with, I have been vaccinated, but then I'm exposed to COVID and I develop symptoms. So the questions are, should I be tested? And am I a carrier of the virus at this point? So Nikki, I'll turn this one over to you.
Well, so that first part of the question, if a person has been vaccinated and then is exposed to someone who has COVID, and then our first person comes up with symptoms, there's a few thoughts that you have to kind of just sort through. And the first one is, they don't have to be tested. That first person does not have to be tested. If they're sick and experiencing symptoms, they could just stay home. Like we've said all along, if you're sick with whatever symptoms, just stay home till you feel better. But you also would qualify for testing. If you want to be tested, you could qualify for that testing.
Free testing.
Yes, yeah, through the hospital, it's free. So you could go either route. So that answers the first part of the question.
And the second part is, are you a carrier of the virus?
Well, so if you do have the COVID virus, then while you're in that active phase, you are a carrier. So in this case, you wouldn't know if you had the virus unless you were tested and had a positive result. And then yes, you would know you were a carrier.
Thank you, Nikki. We have a question. We've got a board over here, so I'm not staring off into the distance. There is a board with questions that are coming up. And the first question here is, will herd immunity ever be reached if a large percentage of the community choose not to be vaccinated? And I think as you heard from Dr. Levanger, the answer is no. We need a large majority of the community to be vaccinated in order to achieve herd immunity. The second question is, what is the estimate of positive cases that have not been seen by a medical care person? So I think the percentage not being seen by a medical person is actually fairly large.
Yeah.
We have encouraged people, if one of your family is sick, test positive for COVID, and the rest of the family is sick, you don't need to be tested. We want you to isolate. We're treating you as if you have COVID. Similarly, even if it's not a family member that caused an exposure, and you then get symptoms from someone else, we offer testing, but we're not telling you need to come in for testing. So I think we have a large percentage of people who have had the symptoms, have not been tested, and have some reasonable likelihood that they have had COVID. We offer antibody testing. Antibody testing can determine whether or not you've had COVID in the recent past, but it is not a necessary thing to have. Unless clinically indicated, unless you're seeing some, what I'll call long haul or long-term symptoms of COVID, having it in the past doesn't make a difference. We're still recommending that you get a vaccine because the vaccine increases your immunity. Just having had COVID gives you some immunity, we know, for a limited amount of time. The vaccine, however, is better. The vaccine gives you additional immunity even if you've had COVID. So we don't have a real estimate of the number of positive cases that haven't seen a medical care professional. We also don't have a true estimate of the number that haven't been tested, right? Because there would be two different things here. At our peak, we ran about 350 tests a week, and we tested a large, it's a fairly decent percentage of the population that we've tested over time. Even though we offered that and the testing was available, we know not everybody came in for the testing. And we didn't recommend that everybody have to come in. So I'll start with that, and if either of you want to add on that.
Yeah, I agree. I think we've got, we did a lot of testing. We did get a lot of positives on the testing. So we know that that we're out there seeing what was going on, but at the same time, like was mentioned, we weren't encouraging people that we were fairly certain had COVID that they needed to come in and be tested, other than, and better for them to just self-isolate and not have to get out into the community.
I also was thinking that with our COVID hotline, when people would call in, if we assessed that they were sick enough, we referred them to their physician. And so most people, like Keith and Dr. Levanger have said, most people didn't have that many symptoms or severe enough to go see a provider. We also offered telehealth visits for most of that time. If people were sick enough, they wanted to be assessed by a provider. They didn't have to come in and they could see a provider.
The other thing we know is that a certain percentage of the population who got COVID were asymptomatic. In other words, they showed no symptoms of the virus or very modest symptoms. So that group of people would not even know to call and ask for medical advice or get help. That's part of the reason we're all sitting here wearing masks, social distancing, and I've got hand sanitizer sitting in front of me. Not if you could be a carrier very easily and not know it, because you might not have any symptoms. The next question is, are there variants present in our community? So the state does variant testing for us. And the state has told us, yes, there are variants throughout Idaho, and they anticipate and believe that they are throughout Idaho, not just in particular areas of Idaho. So the current national stats that I've seen, about 20 to 25% of the COVID cases are now believed to be what I'll call the UK variant. The technical name is a little different, but this is a variant that was first recognized in the United Kingdom. And then smaller percentages of the variants from Brazil. There's actually a California variant. There are many variants. Those variants are present in lesser percentages throughout Idaho. We must act as if the variants are here. The variants, especially the UK variant, the South African variant, several other, are important for us to know about because they are more transmissible. They are easier to give to someone else, easier to catch. They also, and there's varying pieces of data on this, have led to more acute cases for some of the variants. So not only is it easier to get it, the results are worse in terms of the acuity of the illness that you have.
I have something to add. On the question that I had read, someone from the community had asked, why don't we, if we are testing at Teton Valley Health, and no, we're not, and they wanted to know, if not, why aren't we testing for the variant? And so if you talk to a lab at our hospital or at most hospitals, they don't have the proper equipment to do the variants. And so it's not that we don't want to do it, we would do it if we had the equipment, but the labs that have it are these state labs within Idaho. And so the state lab will, if they want variants from our area, they would contact us and request that we gather, some of the specimens or forward our specimens to them. And we just haven't been asked to do that yet. So we would gladly comply, we just haven't been asked to provide that.
Okay. The next question is the Johnson & Johnson vaccine still available? And if so, is it deemed safe? So the Johnson & Johnson vaccine, or Janssen, is actually the subsidiary of Johnson & Johnson that makes it. The vaccine use has been paused by the FDA. They made a determination that based on certain potential side effects, and I'm saying potential side effects, that specifically deal with an illness or a symptom that deals with blood clots, where 6 cases were identified in the US out of the 4.8 million case inoculations that were done with the Janssen vaccine. They have paused the distribution of that vaccine to further investigate whether there is a link between getting the vaccine and getting this particular blood clot illness. We anticipate there will be further meetings of FDA groups on Friday and a further determination of whether or not the vaccine will continue to be distributed, and if so, with what precautions. Of the 6 cases, I believe, Nathan, all 6 were women, all 6 were less than 48 years old.
Right.
So there may be specific restrictions around age or precautions. I want to point out, however, I certainly, for the one woman who died, for the other 5 that were ill, this is a big thing. It isn't something that can be treated, but it is an illness. And I'm not minimizing that. But these vaccines are among the safest drugs we have in our inventory, not just in vaccines, but overall in terms of drugs. Of the 70+ million doses of the vaccines given in the US, and I'm talking all of them, the number of severe reactions or incidents or causes of other things are very, very small. The vaccines, through the testing and through the use, have been proven to be quite safe. Dr. Lemanger, do you want to talk about the blood clot, the DVST, and
Well, yeah, just So what they're finding is in these six patients, there's a clot that they found in an area in the brain. I think what's interesting is they did this, so they gave out 7 million doses of the vaccine, and 6 people have this, been found to have this. So, you know, as Keith said, it's a really small percentage. In fact, I was reading an article yesterday that was mentioning that the risk of blood clot from getting the virus is higher than the risk of blood clot from getting this vaccine. Now, I think it's good that they stopped using the vaccine and they're going to look into it a little bit closer. But even with that being said, you know, that less than 1 in a million are getting a problem is a good thing. The other thing I was going to say on that is I did read that they were looking at this in Europe also, and in Europe today they came out with the fact that they aren't able to make a connection whether the vaccine has caused these or not. So that'll be part of the discussion on whether we continue to use that. But I guess the way I look at it too is the good news there is if there's any concern at all, we do have the 2 other vaccines and they haven't had a similar problem at all. So there's still options if that is concerning at all, that you can still get the vaccine.
Next question is, do you think the vaccines will need to be administered yearly? So the CEOs of both Pfizer and Moderna have both come out with announcements saying that both of those companies are studying how long the vaccine will be effective, whether or not they'll need to be booster shots. The answer to the question right now is we don't know. We're still measuring how long the effectiveness of the vaccine lasts. There have been a number of studies. The good news is we're seeing the vaccines from Pfizer and Moderna both are, if you will, rated at 94, 95% effectiveness. Meaning out of 100 people who get the vaccine, 94 or 95 should not get COVID, even if exposed to it, but potentially 5 or 6 might. What they're finding in actual use now that we've given a lot of these vaccines is the percentage of people getting COVID who have been fully vaccinated is actually far, far lower. So the vaccines are very effective in practical use. We'll determine over the next couple of months whether there'll need to be boosters and whether or not there will be an annual booster or what the period might be.
Yeah, that's one where, again, the information has changed as it's gone along, as the more they learn about it. You gotta remember, they haven't even been studying these for over a year yet, and so they don't know what's gonna happen over time. I know initially when they came out, the discussion was that Pfizer and Moderna could maybe be 2 years, but I think I heard last week that they were thinking they might need a 3rd booster at about 8 months. So there's, you know, there's discussion, but what we've got going is the companies are doing the studies on the patients that they gave them to, you know, during the initial studies, and they're able to see ahead of time when those the vaccine effectiveness is going to decrease a little bit, and so they'll be able to make a decision on when we need to give a booster as it goes along.
The next question is one vaccine more effective than the other? So we have 3 vaccines that have been approved for use in the United States: the Pfizer vaccine, the Moderna vaccine, and the Janssen vaccine. All of them are highly effective against the virus. Yes, when I say one's 94%, one's 95%, yes, there's an established tiny difference. Practically, does that mean anything? I don't believe it really does. When you look at how the Janssen vaccine efficiency was measured, it is measured in a different way than the than the Pfizer and the Moderna. And that makes it hard to do an apples to apples comparison among all three. We're recommending, subject to the FDA coming back and releasing the pause, that get any vaccine. Get a vaccine that's been approved by the FDA. All of them are highly effective. And what they're most effective on is preventing severe cases of COVID, preventing hospitalizations and preventing death. Our goal here is not to eradicate COVID. That's not what these vaccines are going to do. They are significantly lessening the percent of the population that will get COVID, and even more significantly, reducing the percent that get a severe case of COVID, which means a case that might cause long-term effects on the individual or death.
Yeah, I was just gonna say, in order to tell which one's better, you have to do a head-to-head study where you study them all in the same place at the same time. They haven't done that and they won't do that. But as Keith said, all of the, when you looked at the numbers of all the vaccines, there were some people who got vaccinated that did get the virus, but out of the group that got vaccinated that got the virus, in the studies that they did, they didn't have any deaths out of that group. And so that's the key is it's decreasing the severity of the virus when you do get it. And all the vaccines are good at doing that.
Okay, when do you think a vaccine will be available for those under the age of 16? Pfizer has already asked for approval from the FDA for 12 to 15 years old individuals, and we expect that approval to come out in the near term. So I think we will have one vaccine that will be available to children 12 to 15 years old. There will be additional testing done to determine the safety and also the dosage amount, and maybe Nikki, you can speak to that, for what we do with other children that are younger than that.
Yeah, I agree with that. Just everything we've read says that the scientists are all working on that to see, like you say, what dose and what age group would be safe to give the vaccine to.
One of the other questions we got before the meeting was, is the hospital planning any kind of vaccination outreach to specific audiences like homebound seniors through Seniors West of the Tetons, or the Latino community via the Hispanic Resource Center, for example? And I touched on this briefly, but the answer is yes, we're trying to do that. We do have outreach. We've had discussions with Seniors West of the Teton. They believe that their population that they talk to, we have gotten the message out to. We have been working with the fire department, and they have graciously gone out in a number of cases and administered vaccines to those that are homebound. So if you're homebound and you want the vaccine, please call in. We'll schedule that. We'll send fire department personnel with an ambulance out to your home. They'll administer the vaccine, and then if it's a Pfizer or Moderna, they'll come back in a couple weeks and they'll administer the second one as well. We are seeing significant increases in the number of Latinos that are getting the vaccine over the past several weeks. And this is quite encouraging because we want to make sure we reach out to that community. We do staff our Thursday sessions with Spanish-speaking individuals. We have forums in Spanish as well as in English, so we can try and accommodate the language differences. And frankly, we're open to suggestions on how we can get the vaccine to more people. We believe that we should vaccinate as many people as are willing to take the vaccine. We don't want to put any artificial barriers in place of getting the vaccine. Just to be clear, there's no insurance requirement, there's no payment, there's no cost to get the vaccine. Never has been, won't be. So cost should not be an issue, and if you're homebound, please call us. We'll set up something where we can have someone come out to your house and administer the vaccine.
I was just thinking, also like Keith was saying a little earlier, we have already gone out into the community various times. We've gone to the school district for the school staff. We went back last week for the 16-year-olds and up, you know, at the high school. We've gone to private businesses several times, so we've already done some outreach.
And the follow-up question really is, could shots be administered at an outdoor summer community event like Tin Cup Challenge or Music on Main, if there was a controlled space to do so? And the answer is yes, we can look to do those types of things as well. If it's for children, we need the parent there to give consent. If it's an adult, we can certainly get the consent at that point in time. So that everyone's aware, we ask everyone who is vaccinated to wait 15 minutes at the site. We want to ensure if that there's no reaction, and if anything untoward does occur, we want to make sure we have medical personnel there to immediately take care of you. This is trying to be as cautious as possible as we can on the administration of the vaccine. So we are looking for ways to make this work. The one caution we have is the way the vaccine is currently distributed. The Pfizer vaccine is distributed in vials where there's 6 or 7 doses. The Moderna vaccine is distributed in vials where there are 10 doses. Once we pierce or start using a vial, we then have to use everything in that vial in the next 5 hours. So we want to be cautious, given there's a shortage of the vaccines, not to waste vaccines, which means we don't want to give one vaccine and then waste 6 or 5 in the vial. So we're looking for events where there are enough people that we will be efficient in our use of the vaccines. If there are more questions online, please submit them. We're running out of questions, which is a good thing. We're happy to answer any, but please submit those questions if you have any. Nikki, what would you like to say to the public at this point? We'll wait for a question while you're saying something. I'll put you on the spot.
That's okay. Well, I spoke at the school board meeting last Monday, and really, we just talked about, that's been brought up tonight, the main thing for our valley, I think that we have set a goal to reduce the spread of COVID within our valley, and I believe we've done that. And the fact that I believe in our Teton County, there have been 4 deaths associated with COVID-19. And we've talked about before, when you compare that to other cities or counties similar to our population, that number in other counties is double or triple that amount. And so that, to me, that is worth a lot. It's been very difficult on everybody to wear these masks and to, you know, do the basic things, washing your hands more, cleaning things more, but it obviously has made a difference. And so as we're going forward now, just like we've been talking, we'd shoot for our goal to be herd immunity. So the best thing we can do is promote these COVID vaccines and just encourage your neighbors and friends to be vaccinated if they haven't already.
Dr. Levanger?
Yeah, I encourage the same thing. I think a year ago, everyone was talking about how good it will be once we get the vaccine so that we can start getting to the end of that. So we're to that point now. And I think knowing that, the vaccine, again, we've given out 70 million doses and it seems to be fairly safe, it's worth going out and getting to get to that herd immunity point so that we can be safer as we open things up.
So we do have one more question. Can you please talk about the difference in the risk for being outside and inside and not wearing a mask? Nikki, I'll let you answer this.
So just in simple words, if you're inside, I'll just give a few scenarios. If you're inside and you're in a small room with a lot of people, obviously you would still wear a mask. If you were in a room the size of the auditorium and there were 5 people in the auditorium all spread out more than 6 feet, you wouldn't have to wear a mask, and especially if everyone was vaccinated. Then if you think about going outside, children, let's say on a playground outside, and they're all running freely and spread out more than 6 feet, they obviously wouldn't need to wear a mask and they would still be safe. But if you think about a teeter-totter or I think of it like a merry-go-round, whatever that's called, where, you know, say 10 or 15 kids could be all hanging on to that and be right close to each other outside, that would be a time when they would wear their mask. So hopefully that clarifies.
And we have another question. What else can I do as an individual to encourage others to get vaccinated? So vaccines are not mandatory. We want everyone to make an informed decision to get a vaccine. I'll give you my personal belief, and then I'm going to ask Nikki and Nathan to do the same thing. We know, based on what we're seeing with 70 million doses, that the vaccines are very safe. We know they're also very effective, because of those 70 million, there are very few that have gotten COVID. On the flip side, we know that COVID has killed 300,000 people in the US, and we're very worried about some of the long-term impacts of people that have gotten COVID, that they're not over the virus immediately. It's not like the flu, a couple days and you're done. From a health perspective, we're much more worried about someone getting COVID than we are about someone getting the vaccine. And the more people get the vaccine, the fewer people get COVID. Dr. Wagner?
Yeah, I think kind of like I said, you've got, with the virus, catching the virus is such an unknown. You know, we've mentioned that a lot of people get the virus, don't have any symptoms at all, and it runs the gamut to you know, people are dying of it. So there's an unknown there that goes with the virus that is hard to pinpoint, and it's different than most other things that we've dealt with, you know, other infections that we've dealt with in the past, just because of that unknown. Going along with that, because it's such a, I mean, it's a pandemic, it's such a nation worldwide thing right now, getting the vaccine, instead of looking at it as doing something, you know, just to protect yourself, you can look at getting the vaccine as trying to protect everybody. If you get, you know, if we get our 70% of people or 80% of people that get the vaccine, we're doing something to protect the whole community. So it's not just, don't just, I would say just don't look at it just as yourself, as it's something to do for you, but look at it as what you're doing to try to help the whole community.
I was thinking about the question where they are asking what could they do personally to help spread the word maybe. And of course we have lots of social media, Facebook, Instagram, different platforms. And so a person in our community could do, you know, something as simple as have someone take a picture of you or a family member when you receive your influenza vaccine, or just post about it afterwards and let your friends know that you received the vaccine and maybe why you received it or why you believe it's a good idea to be vaccinated. And then also, you know, to just maybe try to be a good listener within your friend circles or professional circles of people that you're around, And if you hear of somebody maybe who might be a little misinformed or just they haven't read thoroughly and understand all the data that are out there for us to use, you know, you could offer and just say, hey, I don't really think that that's correct, and here are some resources that you could study this a little bit more, or you could share what you know about it. And an example, you know, is when you think of just vaccines generally, the influenza vaccine every fall that we start giving on an annual basis, those of you who have studied a little bit know that it has an efficacy rate between 42% and up to the 80 to 84%, you know, range, depending each year on how well the scientists estimate. But with the MMR vaccine, the measles, mumps, and rubella, that's up to like 92% with one vaccine, and when you get the second vaccine, it's up to 97%. And so with this vaccine, you know, if we're saying the scientists have found a high percentage in the 90s, and with both doses of Pfizer and Moderna, you know, you're in the high 90s% of effectiveness. That means a lot to me. So, you know, I would be more inclined to receive the COVID vaccine, not the virus, the COVID vaccine, you know, than maybe the influenza, because it's that much more efficacy rate.
We have one other question that's come up. Why are other countries such as Brazil and India struggling with such high COVID numbers? Have they not received the vaccine? Nathan, you want to start on this one?
I don't know if I know the answer to that one. I know that the United States, there are some countries that have focused a lot more on vaccines than other countries have. I'm not sure if these two are one that were in that group or not. I know that the variant coming out of Brazil was a little bit more virulent than the original, and so if they're dealing with more of that variant, that could be part of the issue. The vaccines that we have, in all the tests and everything they showed, they did say that the vaccines that we have, the Pfizer, the Moderna, and the Johnson & Johnson, all are effective against those variants, but that's about all I know on that one.
Well, and I was just thinking also, I would have to look those two up as well and study a little bit more, but it could be, are the high numbers coming from crowded areas or from areas where they don't have enough PPE possibly, or don't have access to the vaccine? Those are all things that might be part of that.
I think what we can address, we still have hotspots in the United States. If you look at certain states, certain areas, the virus is still here. The virus could very quickly take effect. We had a discussion a little earlier before we turned on the recording about how the hospitalization rates in eastern Idaho change markedly. They could go from 50% to 75% in a couple of days. So the virus can quickly attack, it can quickly replicate, and we're back to why do we need to get everybody vaccinated? It is to protect others and to try and slow that down as much as we can.
So here's some information. It does look like, according to the information that came up, that Brazil and India are a lot less vaccinated. In the United States, the number I heard was 30% have received their second dose. This says 26%, but India is at 1.3% and Brazil's at 4.3%. So that would definitely play a part in why there's so much going on.
Yeah.
The next question is, didn't the CDC change their school recommendation from students being 6 feet apart to students being 3 feet apart?
They did change that. I'm thinking about a month ago, we did see that announcement that when students have a mask on, they could be 3 feet apart. That's true.
The Next question is, what recommendations do you have for people who want to travel on an airplane?
I would say, and this is more, I mean, you definitely want to wear a mask. You actually have to wear a mask when you're on a plane. That's one of the things that President Biden has put in is masking in any federal. So if you're on an airplane, on a train, on buses, then you have to wear a mask. So wear a mask. Traveling within the United States, things are pretty open. It doesn't, there's no, as far as I know, you don't need to show your card that you've been vaccinated or not vaccinated. Basically, they're just, if you're in the airport or if you're on the plane, you're gonna be wearing a mask during that time, whether you've been vaccinated or not. So that's, and I think I guess the other part would be if you're traveling, check with the airlines you're traveling with, check with the place you're traveling to, because I know some places you travel to have different ideas on what they need, and that changes again on a weekly, daily basis. So you want to check and see where you're going and make sure you don't need testing before you go, or you do need testing before you go, and you can kind of stay on top of that.
And also check on the quarantine requirement. Some locations still have a quarantine requirement, especially for those who are not fully vaccinated.
And I was just thinking generally, if you're thinking of traveling, make sure that you're vaccinated first. That's your best protection, to just make sure you're vaccinated first.
Okay, the next question is, it seems that we have seen fewer cases of the common flu this past flu season. Is this true? And it absolutely is. Nikki, you want to address this?
Yes, we talked about this last week at the school board meeting as well. Someone was asking if, did we think there was any effect within our healthcare system in the Valley? Did we see any difference? And one thing for sure that has been brought up in this question is we've hardly had a flu season at all through our healthcare system, which is not heard of. By this time of year during the winter months, we've had a lot of influenza A and B. We've had a lot of RSV in children, and we just have not seen that this year. Maybe one case that I've heard of. And, that's all the tests that would have gone through our lab at the hospital and all the clinics. So that's significant, proof that the masks did help, because influenza is a droplet precaution disease, meaning that the regular face masks, medical masks, they shield us from that. So that has made a significant difference. Another thing I had mentioned with that same question is just a trend in the Valley. We have seen that people who are, I'll say over 50, who have chronic conditions, some of those people put off their medical care because they were afraid to come in, which is a normal reaction during the beginning of the pandemic when everyone was worried to go out of their homes. And so they put off some of the chronic care. And so we've seen an influx of that now the last couple of months as people are coming out again, trying to take care of some of their medical problems that they just had, put off.
Okay, the next question is, if vaccinated, should vitamin D3 and zinc still be recommended? So,
sure. Here's vitamin D. We're north of the 45th parallel, and so we're at risk for low vitamin D in general. Most of the time when I check vitamin D in people, they're low to low normal at any time. So taking a vitamin D supplement is going to be beneficial for your immune system, and like I said, I can say that because I know that almost everyone, if you check it, that's not taking a supplement is going to be low. Zinc is the same thing. Zinc you're not going to be set to be low in, but having a little extra zinc to help fight, it builds up your immunity, and it's not a bad thing to have on board.
And that's regardless of whether or not you've been vaccinated.
Correct.
The next question is, what is the status of needing a vaccination passport to travel and to enter businesses? Do you think this will become a reality? So there's been a lot of discussion. What the vaccination passport is meant to be is a means of providing proof that you've been fully vaccinated. So whether it's the card you got when you were vaccinated or some other electronic mechanism, that an app you put on your phone, something like that, the mechanism here is to show that you've been vaccinated, with the belief that people that are vaccinated would be able to do some things differently than those that have not been fully vaccinated. There have been many discussions on whether or not this is going to occur. I'm not aware of any mandate to have that occur at this point. And there are a lot of reasons right now where it would differentiate between some of the people that have the vaccine and some of the people who don't but really want it. And I don't think that difference is one we want to establish at this point in time. I think we are going to see people being asked if they've been vaccinated. That'll become a common or a more common discussion point among people, and that's something that individuals can deal with on an ongoing basis. But whether or not we have a mandated vaccine passport, I think it's quite in doubt at this point.
Yeah, I think it's going to be more there that certain places may give you more freedom if you've been vaccinated. I heard over the weekend there was a baseball game, and they had a special section for people that had been vaccinated. So because they could be closer together, they didn't have to be so far apart. And so I think things like that will happen where there'll be ways that if you're vaccinated, you can take advantage of things. I hope we don't get to the point where we need it to travel or we need it to get through. I hope we get to the point soon where everyone that wants the vaccine can get one, and then we won't have to worry about showing whether we have it or not.
But let me add one thing. We recommend highly that everyone who has been vaccinated and gets the vaccine card, take a picture of it with your phone. This is not for a passport. This is one, so when you come for your second dose, you know which vaccine you need. And two, if we get to the point of potentially getting boosters, that will help establish what type of booster you may need. So we're recommending everybody keep a record of their vaccines. You got a card when you're getting a vaccine, no matter where you get it. It's a CDC printed card. Please take a picture of it on your phone. That we think is the safest way to keep that information. If you don't have it, you've been vaccinated at the hospital or a different place, go back to where you were vaccinated. They can look that up, and we can get you a new card. But please take a picture of it, because that's going to be long-term the best way to do this.
And I was just thinking that typically when you're hired for a job or your children go to school or you went to school, you're asked to provide an immunization record. And so most moms and dads keep their child's immunization record for them from their elementary school years, and then the person goes on and keeps that for the rest of their life. So you can just keep that card with your other immunization records in a handy place, or a place you know where to find it.
The next question is, what kinds of things can we do once we're vaccinated that we can't do without the vaccination? So Nikki, I'll let you start with this.
Well, an example, if you want some reference, on the CDC's website, it posts what's new, and I think it was the very last thing they posted that was kind of new. So we had a situation last week that I could share at our vaccine clinic, where a person came up to me and said that they were an adult mom and they were going to be traveling for the first time to a relative's home, but in another, out of this county place. And there were going to be 7 or 8 adults and then this one child who had not been vaccinated yet. And everyone else in the group had been vaccinated. And so under the CDC's newest guidance on that, this family is safe to do that, and the young woman wouldn't have to, well, none of them would have to wear a mask. So they're in, let's say, a home, a person's home, and there's 8 adults that are all relatives, and they've all been vaccinated, and the one, say, teenager that hasn't been, that would be okay for that family to be in the home. And so that's something new and happy that has happened, that people are able to see relatives that they haven't seen for a while, or they put off, vacations and trips and things. And so that's one off the top of my head I can think of. Another example might be in your workplace. If you're in an office, not a very large office, but where you're spread out the 6 feet at your desks, and all of you in that office have been vaccinated, and it's been past 2 weeks, then you wouldn't have to wear masks. So to me, that's a couple of the things that we're able to do because we've been vaccinated.
The other one is that if you've been vaccinated and have a positive exposure, then you don't have to self-isolate. You can keep going with your life.
Yeah.
The next question, how important is it that we properly eat and exercise? Will this also protect us against COVID? So Dr. Levanger, I'll let, this one's a softball.
Yes.
You have this one.
It is good. Get your exercise, eat right. Yeah, no, that anything you do to increase your immune system, to build up your body's defenses is going to be good. So eating right, exercising, getting plenty of sleep, drinking lots of water are all good. And yes, it will help against COVID as well as any other problem out there.
What type of long-term effects are we seeing with people who have had COVID? Do we see any negative long-term effects from the vaccine?
So the long-term effects of COVID, again, it's different. There's some people who are having no effects at all, but there are some people who are having a cough that lasts for months. There's some people who are having, and we kind of talked about, the blood clots with the vaccine, but there's a higher risk of blood clots with the virus. And so some people are getting blood clots that are lasting and they're dealing with. Some people are getting just a general feeling of fatigue, malaise, not recovering as quickly as others. And again, it's there's no way to know beforehand if you're going to be one of the people that has the long effects of it, or the side effects, or they're not side effects, they're the effects that aren't clearing up as quickly as some diseases, or even as COVID, or if you're going to be one who's not. So that's the hard part about this is there are some serious long-term things that are going on that you just don't know. I don't remember, what was the next part of the question?
Let's go back and take a quick look. Well,
Any negative long-term effects from the vaccine? No. Most people are, a day or two of a sore arm and maybe feeling a little under the weather. But other than those 6 people who they're looking at with the possible clots, I haven't heard out of the 70 million other that have had the vaccine, I haven't heard of any long-term effects from the vaccine.
Next question. If you are older and in bad health, should you still get the vaccine? Are there any dangers for elderly people getting the vaccine?
Yes, if you're older and in bad health, you should definitely get the vaccine, because that is a risk of having worse things happen to you if you get the virus. And there is no known bad effects of taking the vaccine as an older person. Really, I kind of chuckle because the only, as you look at the vaccine, the only thing they say that you shouldn't take the vaccine is if you're allergic to the vaccine. And so that's really the only reason not to take the vaccine, but there's no health issues that are related to taking the vaccine. And yes, the more comorbidities, the more problems you have, diabetes, hypertension, obesity, cholesterol issues, the more of those things that you have, the more protection you're going to get from the vaccine, because that puts you at a higher risk.
And the one other point I'll make, that the older you are, there's a relationship between age and the amount of reactivity or your reaction to the vaccine.
Right.
So they have found a markedly lower percentage of reactivity, pain, malaise, the low fever that you might get from the vaccine if you're older. So there is one advantage to
Right.
being older here.
Less side effects.
Teton County has had 4 deaths because of COVID. Sorry, we're having a little issue here with the device. Other counties with similar populations have had higher death numbers. Why is this? Nikki, I think you addressed this partially, if you want to go back to this.
What we had just talked about a little while ago was one of the best things about our county being so diligent in wearing face masks, washing hands, trying to keep things clean in the school district and throughout the community. You know, we've been very strict in our county, but one of the best things about it is that we believe that has helped us reduce the number of deaths. And I had mentioned that in our county, we've had 4 deaths, but if we look at other counties in Idaho and around the country that have our population size, they've had double or triple the numbers. And so we would attribute that to our county residents' efforts to wear masks and to do the other things the CDC has recommended.
The next question is, will the AstraZeneca vaccine be approved in the US? Is it an effective vaccine? To the best of my knowledge, AstraZeneca has not yet applied for FDA approval for the vaccine. AstraZeneca is in widespread use elsewhere in the world, and when they apply for FDA approval, my belief is they will probably get it just like the Janssen, the Pfizer, and the Moderna vaccine.
Yeah, I know they are using it in Europe, and I know that they were looking at some concerns with AstraZeneca in Europe also, but again, it was a really small percentage of people that got it, had some issues. I think if they apply and if they look at getting okayed in the US, I'm sure that they'll get it okayed, but it's interesting because now we're to a point where there's more and more availability of the vaccines that are already here, that I'm not sure this far behind the curve if they'll do it or not.
Next question is, are variants more contagious? And if so, are common non-N95 masks still useful? So I'll take the first part of this. Are the variants more contagious? The answer is some are, some aren't. There are many variants. The UK variant, which is one of the ones we think is 20-25% of the US at this point, is more contagious. But some variants are less contagious, and those are going to die out of their own natural selection. So we're going to see less of them. For the ones that are more contagious, in terms of masking, there have been multiple recommendations on masks. One was to double mask, to put 2 of these on, or 2 types of mask on. The other is certainly the N95 mask itself. As a hospital, as a business, we have mandated the use of these types of surgical mask or cloth mask in our building. We have not mandated the use of N95 mask unless you're treating a patient, you're up close with the patient, there's a high transmission of aerosol, in which case we are telling people to use the N95 mask. The higher transmissibility does mean there's more risk associated with getting the virus. We're back to, please get the vaccine. If you keep your social distancing, your good hygiene, and your mask usage, even if it's not an N95, even with the variants, you're significantly reducing the possibility of getting the variant. If you wish to reduce it even more, an N95 mask will reduce your transmissibility, your risk, more than these masks.
Sounds good.
Okay, we appear to be, the questions have slowed. Thank you to all that have submitted the questions. The COVID nurse hotline is being staffed at the hospital weekdays. If you have any questions, please call in to that hotline. We'd be happy to try and answer any questions. See your primary care provider with questions that are specific to your health, because there are differences and each person's unique. Talk to your provider. They can give you more information that's very specific and can help you in terms of weighing a decision on whether or not to get the vaccine. Any other comments?
Nope.
Thanks to the school system for hosting us here and publishing this live so that we can get that out there. Please let us know if there are other things you want to hear. And if you have suggestions on how we can get the vaccine out, please contact the hospital. We are happy to hear those. We're continuing to run, as I said, Thursday, vaccine clinics. Roland's is running vaccine clinics. Corner Drug is running vaccine clinics on their own, as well as working with us on the Thursday clinics. So please reach out. There is sufficient supply of vaccines right now to get vaccinated. There is not a long line, there is not a long waiting period, and there's no issues associated with using one of the 3 sites. Pick the one you think is best, the one that fits your time frame. But please get vaccinated. If not just for you, as Dr. Levanger said, for the rest of us, please get your vaccination. Thank you all.
Ronald.